Dear students, welcome back. In this session, we are going to discuss about the sole of the foot. Sole is the undersurface of the foot, and the structure of the sole is similar to that of palm, and the skin, the superficial fascia, deep fascia, muscles, vessels and nerves are all comparable in these two homologous parts, that is palm of the hand and the sole of the foot. Okay, if you see the skin first, the skin of the sole like that of palm, which is very thick for protection. Okay, and the skin is firmly adherent to the underlying plantar aponeurosis, and the skin is also having some creases, that means lines on the foot. Okay, so these creases increase the efficiency of the grip of the sole on the ground. The skin is mainly supplied by three cutaneous nerves. One is the medial calcaneal branches of tibial nerve, which is having the root value of S1 and S2. Okay, and the branches from the medial plantar nerve to the larger anteromedial portion, including the medial 3.5 digits. So this part, so this medial 3.5 digits, and also the anteromedial part, which is supplied by this medial plantar nerve. Okay, and next one is the branches from the lateral plantar nerve, and this nerve is supplying the smaller anterolateral portion, including the lateral 1.5 fingers, which is supplied by the lateral plantar nerves. And the small areas on the medial side, very small areas on the medial side, which is supplied by the saphenous nerve. On the lateral side, small areas on the lateral side, which is supplied by the sural nerves. Okay, and these are all the cutaneous nerves which are supplying the sole. Okay, and if you see the subcutaneous tissue, which is loaded with fat, this is more in locations where the foot comes in more contact with the ground. Such locations are heel. Okay, at the below this subcutaneous, you'll have more fat, and then the heads of the metatarsals, you can find more fat, and also the tips of the toes, and in the subcutaneous tissue there are thin fibrous septa run between the skin. For example, this is the skin and this one is the deep fascia. There is a thin fibrous septum run between the skin and the deep fascia. These septae separate the fat into small loculi. Okay, so these thin fibers septa, which are nothing but superficial fascia. Okay, and this superficial fascia also take part in the formation of superficial transverse metatarsal ligaments. So this is about the sole of the foot as well as the superficial fascia. In the next session, we are going to discuss about deep fascia, in that the very important structure, that is plantar aponeurosis. Thank you.